How to track and stop the spread of the coronavirus outbreak, mitigation efforts, and helpful tips. A presentation by Morgan Wall. Now, what is the coronavirus? It's also referred to the name of COVID-19. The virus was first located at an animal market in Wuhan, China, where it spread like wildfire. Just like humans, animals can also contract the virus. The virus is a part of the family of an infectious disease called corona. Also within the family is the Middle Eastern respiratory syndrome and systematic inflammatory response syndrome. COVID-19 is spread through human-to-human contact, but when an infectious person coughs, sneezes, and is within 6 feet distance of you, then you're more likely to be at risk. On March 11, 2020, the World Health Organization officially declared COVID-19 a pandemic. This virus has had a profound effect on the world economy and many have lost their lives. The following statistics is from Johns Hopkins University. Globally, over 1,050,825 people have died, but 25,500,316 have recovered. In the United States, there has been over 109,646,837 total COVID-19 tests done. In Pennsylvania alone, there has been 8,223 deaths and 135,499 people recovered. There are many symptoms of COVID-19 to watch out for. Anyone can have them, and most people are symptomatic rather than asymptomatic. It takes approximately 2 to 14 days to contract symptoms after exposure, but all cases vary. Some of the most common symptoms is loss of taste and smell, coughing, fever, dizziness, sore throat, nausea, and shortness of breath. Some more severe symptoms that require immediate medical attention is new confusion, trouble breathing, persistent pain in areas such as the chest, and when your lips or face turn a bluish discoloration. Do your part in mitigating the spread of the virus. Wear a mask so it covers both your mouth and nose. Stand at least 1 meter distance from others. Carry hand sanitizer everywhere. Don't touch your face in public, and wash your hands with soap on a regular basis. The young, elderly, and those with compromised immune systems are at higher risk of contracting the virus. Also, do not go out if you do not need to. If you are exposed, the first step is to not panic. The mortality rate is very low, but the disease spreads quite easily. Contact your doctor and get tested for COVID-19, then self-isolate for 14 days consecutively. Do not invite people over and risk exposing others. Most places of work will let you telecommute during these unprecedented times. Also, be self-monitoring for symptoms as well as safely following precautions. Coronavirus has mutated and there is now a variety of mutations. As of right now, there is no vaccine available, but MERS and SARS has led insights on the virus. There are 2 ways vaccines are made, one being live vaccines that injects a weakened strain of the germ within the virus to promote immune responses and create antibodies. The second is inactivated vaccines and a use of dead version of the germs to fight the virus. A common example of this would be the flu shots. The problem with the live vaccines is those with weakened immune systems can contract the disease easier, but it has a stronger response within the body than inactive ones do. Vaccines take time, so long-lasting effects can be studied, and it cannot be rushed. There are a lot of things that we want to be doing right now, but they aren't necessarily what we need to be doing right now. Please make good choices. A quote by Dr. Maria Van Kerkhove of the World Health Organization. Reporting, defining, collecting, tracing contacts, and hospitalization information on COVID-19 cases and patients helps organizations like the Center for Disease Control and Prevention stay ahead and alert in tracking the virus. We all have to do our part in keeping ourselves and others healthy. Overall, if you start to develop symptoms, contact a medical professional. Socially distance, wear a mask, and quarantine if you have to.